A tummy tuck can transform your body, but only if you pick the right one. In this video, I'll break down the difference between a regular tummy tuck and a Fleur-de-Lis one. Hello, my name is Omar Tillo. I'm a consultant plastic surgeon and medical director of CREO Clinic. Check out our tummy tuck playlist for everything you need to know about this procedure. What is a traditional tummy tuck? So a traditional tummy tuck is a surgical procedure that aims to tighten the skin of the abdomen, and it involves cutting most of the skin of the lower abdomen from the level of the umbilicus, belly button, down to the groin area. And by doing this, it achieves tightening of the skin of the upper abdomen as well as the lower abdomen, and it leaves a scar which is transverse across the lower part of the abdomen as well as a circular scar around the umbilicus. What is a Fleur-de-Lis tummy tuck? A Fleur-de-Lis tummy tuck is a type of tummy tuck or abdominoplasty surgical procedure that aims to tighten the skin of the abdomen, upper and lower abdomen. However, it involves two incisions or two excisions of skin. There's a horizontal excision along the lower abdomen as well as a vertical excision of the skin, and that aims to tighten the skin in a horizontal way as well as in a vertical direction. It leaves a scar along the lower abdomen transversely from side to side, as well as a midline vertical scar from the sternum, from the lower sternum all the way down to the pubis area. They both tighten the skin, but depends on the distribution of the skin laxity. So if it's only lower abdomen and there's less vertical laxity on the upper abdomen, just pull it down. If there's lower abdomen and a vertical excess in the middle, you have to cut that excess to pull it from side to side as well with a Fleur-de-Lis. So how does the Fleur-de-Lis tummy tuck differs from traditional tummy tuck? With the Fleur-de-Lis tummy tuck aims to address an excess of vertical skin in the midline. So people who lost a lot of weight and they have a lot of excess skin on the middle of the abdomen in a vertical direction, you have to cut that skin vertically and pull the skin from side to side, because pulling it down, it's not enough without pulling it from side to side. And that's why it differs in the scar. So whereas the traditional tummy tuck, you have a horizontal scar on the lower abdomen, with the Fleur-de-Lis, you get that scar as well as another scar along the midline from the lower part of the sternum all the way down to the pubic area. And in terms of the recovery, we expect the recovery to be slightly longer with the Fleur-de-Lis because of the extra incision. So the healing, the recovery, and the surgery itself tends to be longer than the traditional tummy tuck. So which treatment is right for you? So the best candidate for traditional tummy tuck is patients who have excess skin horizontally, especially on the lower part of the abdomen around the umbilicus, with less elasticity from side to side. So in those cases, what we do, just cutting the skin on the lower abdomen and pulling it down, it achieves full tightness of the skin of the abdomen. However, in other patients who have elasticity from side to side, because they have more skin laxity, mostly to do with excessive weight loss. If they have a lot of skin laxity and skin excess in the middle of the stomach, just pulling the skin down may not be enough. Then a Fleur-de-Lis would suit those patients better. Every patient situation is different and individual. However, the traditional tummy tuck tends to work more often with postpartum skin excess. So after pregnancy, most patients, the vast majority of patients, they need standard tummy tuck. Most Fleur-de-Lis procedures, if not all Fleur-de-Lis procedures, are usually done on patients who lost a lot of weight, so massive weight loss, who have laxity from side to side. So make sure you consult an experienced and qualified surgeons to help you choose the best decision and the best procedure for your situation.